Thank you so much for joining us for this, our first COVID-19 press briefing of the week. We have much to deliver today. Today, Orange County Mayor Jerry L. Demings will discuss our goals for the week, vaccination sites, and the great work being done by Orange County Fire Rescue. The mayor will also discuss our COVID-19 infection numbers, positivity rates, and the reopening of Orange County government. Orlando Mayor Buddy Dyer could not be here with us. However, Dr. Raul Pino from the Florida Department of Health is here to discuss details on the vaccination process as well as COVID-19 trending in our area. Dr. Thomas Prince from the Florida Department of Health in Orange County will be here soon to administer the vaccine to 3 of our county commissioners. The mayor will tell you more about that in a few moments. So here's how it will go today. The mayor and Dr. Pino will give their remarks. We will take your questions from where you are. Then Dr. Prince will inoculate the commissioners, and then the parties will be available for interviews after the inoculations have taken place. We have so much to do, so please, reporters, we love you. Only one question, please. One question, please. And then you can ask as many questions as you want after the vaccination have taken place. So we'll begin this press conference with Mayor Demings. Mayor?
All right, good afternoon to all of you as we now begin our press briefing number 121 since we started last year. I also want to acknowledge as we begin Holy Week this week, we have a lot to really get accomplished during the next few days. I want to say thank you to our commissioners who are joining us, who will in just a few moments be receiving the COVID-19 vaccine. We are joined by Commissioner Myra Uribe, Commissioner Maribel Gomez-Cordero, and Commissioner Emily Bonilla. Now, Commissioner Wilson has joined us already as well, but she has proof that she's already received the vaccine, so it's not because she is afraid to receive it. She's already received it. So, commissioners, stand by. We'll be with you in just a few moments. Today also is a significant rollout day for us. All Florida residents who are age 40 and up are now eligible for the COVID vaccine at any vaccination site. This morning at 9 a.m., the Florida Department of Health in Orange County opened its vaccination site at the Convention Center, and we had 1,850 appointments that was available. I will tell you that those appointments were taken up within the 8 minutes of starting opening the portal this morning. If you were unable to get an appointment, we ask that you visit our website at ocfl.net/vaccine for other vaccine options within the county. Later this week, we will announce when the portal will open for appointments for next week. The Department of Health in Orange County is working very closely with us on that, so perhaps on Thursday of this week we'll announce when the portal will open again. My goals for the week include several things, but first off, the number one goal is always to stop the spread of the COVID-19 virus within our community as we endeavor to work towards achieving herd immunity. Number two, to ensure all qualified residents know about the many places to get vaccinated within our community. Number three, to continue to reach our most vulnerable and underserved populations to help them get access to the COVID vaccine. And lastly, the testing is still a priority in our county. We will continue to offer free COVID testing at our health services testing site at Barnett Park through the end of April. The site is open 7 days per week, 9 a.m. to 5 p.m., and details are also on our website at ocfl.net/testing. I will say to you that this coming weekend, we will not be offering testing on Easter Sunday. Okay. Also, it is important that we continue to really offer testing within our community because we really want everyone to know their status in order to help control the spread of the virus. With The expanded eligibility this week, I'm pleased to also announce that we have another opportunity for COVID vaccinations through our valued partnership with Advent Health. The Florida Department of Health in Orange County is allocating another 3,500 doses that Advent Health will distribute this Friday, April the 2nd, at their pop-up site outside the Orlando International Airport. The vaccines at this site will only be available to those 40 years and older who are eligible under state and federal guidelines. Appointments are necessary for the Advent site. In order to sign up, you can go to our website at ocfl.net/vaccine. We are thankful for community partners such as Advent Health for stepping up to help us distribute even more vaccines in Orange County. Thus far, Advent Health has delivered more than 113,000 COVID-19 vaccine doses within Central Florida. So kudos to Advent Health. I also want to say we have a great partnership with Orlando Health. Orlando Health has vaccinated some 63,000+ individuals as well within our community. The FEMA-operated vaccination hub at Valencia College West Campus, located at 1800 South Kirkman Road, remains open 7 days per week from 7 a.m. to 7 p.m. We do suggest that you arrive early at that site. Remember that no appointments are required for the FEMA sites. Starting today, the Valencia West Campus site will be able to administer some 3,000 first doses of the Pfizer vaccine per day. Additionally, this federally supported site will remain open for 4 additional weeks. That's good news. It was announced that that site will not close until May the 26th. So you have many opportunities to go to the Valencia West Campus site. Again, 3,000 first doses of Pfizer vaccine per day. No appointments are required, again, at that site. I do want to also mention that the FEMA vaccination site that is open daily at our South Branch Library on Orange Blossom Trail now has updated its hours from 9 a.m. to 5 p.m. daily. Again, they will be operating 9 a.m. to 5 p.m. As I mentioned in my goals, Orange County continues to work to provide vaccination sites in key areas throughout our county to help serve as many residents as possible. We are able to do this through the partnership that Orange County Fire Rescue has with our various partners, including the Department of Health and the state at the other sites. Since the vaccine became available, our firefighter paramedic teams have provided 7,550 COVID vaccinations. Thanks to the personnel there, we have one of our division chiefs who are here, or battalion chiefs who is here, that helps to operate the program should you have any questions. Also, I want to talk about a program that we're doing today, outreach. So far we have been to 8 different churches, 2 community centers, 14 senior living complexes, which are 55+ communities. Last Friday I had the opportunity to go out to the town of Eatonville and participated in a vaccination program there at the Macedonia Missionary Baptist Church. Some 520 vaccinations were done at that center. Today, Orange County Fire Rescue was at the Episcopal Church of St. John the Baptist, located at 1000 Bethune Drive in West Orlando, and also at the Joy Metropolitan Church at 2351 South Fern Creek Avenue. At each one of these locations, approximately 500 doses were made available. And now for the update on the COVID-19 numbers here within our counties. 123,000 persons have tested positive for the COVID-19 virus within our county. 1,182 residents, unfortunately, have died as a result of the novel coronavirus. So our prayers certainly go out to those families who have lost a loved one. Each time we do a briefing, we have new numbers that are added to the list and new names. All right. With the relatively low number of new cases, I'm happy to also report that Orange County government will move into the next phase of our reopening of county facilities. Our county facilities will be reopened on Monday, April the 5th. It includes the following: the county's 2 senior citizens, as well as our gyms, fitness centers, and outdoor courts will open with limited capacity at 50%. Our summer youth camps at our county parks and the History Center will reopen with increased participation. In terms of public works, our building, zoning, and planning divisions and utilities will reopen their lobbies and our main buildings to the public with appointments required in order to speak with a county representative for information purposes only. Individuals applying for various building permits will still need to complete applications online. However, again, you can go into the offices in order to talk with a person if you're seeking information only. We will continue to conduct the online services going forward. We have made this decision primarily because of the relatively low numbers that we have of new cases here within Orange County. So I'm happy to say that we are returning to some sense of normalcy at this time. And so with that, I'm going to turn it over to Dr. Pino.
Good afternoon, everyone. Good afternoon. Some of the information that we are going to provide you has some mixed messages, so bear down with me. Our recovery rate has decreased to 96% from 97 that we had before. And the number of deaths has gone up to 1,182. We have 9 additional deaths since we talked to you last. Could you put the graphic up? And although this is happening also, I'm going to show you we have seen a significant decrease in the number of deaths from month to month. As you can see, we start our vaccinations efforts in December, exactly December 26th. And then January, we have a month that was equally as high as July of last year. And then on in February, dropped to half, approximately 50% of the month before. And then this month, we are at the end of the month, and we only have 27. Although even 1 is too many, seeing this decrease is significant to our community, and we hope that is sustainable. And what do we have to do to make it sustainable? And that's part of the issues that I will talk to you today. The 9 additional deaths, 7 had unknown conditions, 2 didn't, 4 were female, 5 were male, and 2 were black, 3 were other, and 4 were white. Our appointment system, as the mayor mentioned, will open on Monday. We will have to be ready for 16 and older. Now, there's a caveat for 16 to 18. Those are still considered to be minors unless they are emancipated, which they will have to provide proof of it. So for a minor to be vaccinated, it has to have someone that has the ability to make healthcare decisions. So that has to be a legal custody or a biological parent. And parents, and we will explain this on Thursday, parents will have to register themselves and then register their child under their name to be 100% sure that an adult is making the registration for a minor. Those are little things. We will explain all that when the system is ready, and that's why the system cannot open yet, because they have to work with those small details. As the mayor mentioned to you, all the appointments that were open this week went off very fast this morning. We have so few because we have a lot of second doses that we are doing from 3 weeks ago. So that's the mix match right there. Now, interesting, for the variant cases, we have 59 additional variant cases reported to us. We are investigating. It looks like it was a data bench that was dropped over the weekend. So our total cases right now on variants are 80 cases. The numbers is significantly higher that we have explained to you before, but we also have said that those numbers are in reality higher than we are projecting. And these are retrospective analysis that are done. So there probably could be as many other cases out there. The variants are 78 are from the British variant. That is the B117. One is the Brazil variant, P1, and one is the California variant, which is B1427. The date of some of these reports is as far as December 24th of last year. So that's why I'm saying we are investigating what these numbers and the meaning is. So we rerun the numbers this afternoon, and our county has given 481,216 doses of vaccines. So by Thursday afternoon, when we are here together, we are probably going to be in 500,000, which is very, very significant. Since we talked to you last, we have added 54,565 vaccinations were done between Friday, Saturday, and Sunday, or at least reported to the state on those days. So to give you the percentages, and we are doing extremely well in these cases, for people over 40, we have completed meaning have 1 and 2 or Johnson & Johnson, 142,591 individuals over 40 years old have completed the vaccination. And for Orange County residents, that is 123,000, which is about 21% of that population. Now, for the general population of Orange County, including everyone, resident that has received more than one doses is 270,209, and that's 19% of our population. So we are in good shape and will continue to accelerate our pace. We have some observations to make to the public. First, last week was the first week that we have more cases than the week before since we have seen a decline. The positivity rate increased slightly for the 14-day average from 5.4 to 5.8. Hospitalization are significantly down, deaths are significantly down, and the recovery rate has decreased a little bit. We also last week saw at some point a little bit of an increase on ER visits for COVID-19-like symptoms. And last week, I don't know about this week yet, but last week, about a third of all the individuals that were hospitalized were younger than 45. So the alert is we have protected the older segment of the population. Deaths are significantly decreasing. Infection in long-term care facility are almost non-existent, very low, for patients and employees. But there has been an increase in the younger segment of the population, which people from 15 to 24 account for over 30% of all new infections. So that's why we need to aggressively move into the younger segment of the population. So please come and get vaccinated when the appointments open coming week. With that, I will answer any questions that you may have. May you? Thank you.
Okay, we do have Mr. Scott Howard here from the school district. If there are any questions for the school district, if there are any questions regarding our community engagement efforts, we have Battalion Chief Egan, who is here, who can respond to those questions. We have Mr. Tim Boldick from our compliance team, if there are any related questions there. And then we have our commissioners who can answer any of the tough questions that you all might have today. All right. Anyway, we will translate in Spanish if need be. We have Ilia Torres, who's here, and we have Director Banks, our Public Safety Director, here as well. So we'll open it up for any questions.
Lauren Seabrook, Channel 9. Mayor, this question is for you and Dr. Pino both. This weekend I asked a group of about 7 people my age, people who don't tend to watch the news, if they planned on getting the vaccine. All 7 of them adamantly said no. What is your plan to try to reach that generation and change these mindsets when they're not watching the news? They may be on TikTok or Instagram and those types of things, but not the news.
So I think in order to answer the question, we need to know what your age is. Okay, so I guess the question then is, what can we do to encourage 35-year-olds, young adults to get vaccinated? I think we're going to have to use a marketing approach to those various platforms, and through those various platforms that 35-year-olds are on. We're going to have to use the people who look like them, I think, and then we have to use other trusted voices within our community, from healthcare providers and physicians to other public officials, to other athletes or other individuals who may be able to appeal. And we do have plans to do all of that here within this community. And perhaps, Lauren, at some point, we'll have you get vaccinated on television. Will that work? Have you been vaccinated yet?
Got my second dose.
Okay. You've already had the second dose?
Yeah.
Okay. So what about your husband? Okay. Does he fall in that category? Maybe we'll use him to come forward and or others and demonstrate that it's a good thing to do. So Dr. Pino, I'll throw it over to you.
I mean, that's a reality. People who has been less affected in the sense of the, dire consequences of the pandemic are probably less concerned about it. But there's also a reality is that using employee-based pods, closed pods, may help to bring the vaccine to those individuals who are extremely busy, work 9 to 5, don't have the time, the luxury of time. Some employers are also incentivizing individuals to get vaccinated, and there could be a reality. There are some states that are trying a vaccine passport. New York, I believe, was in the news for piloting the process, and it could be countries that may do that as well. And that's a segment of the population that travels a lot. So for their own convenience, if there are non-restrictive medical conditions for which these individuals should not be vaccinated, I will advise that they get vaccinated. Again, it's free. It's free right now. It may not be for forever. And also, again, other countries where liberties and freedom is not the same that we have in the United States may require those vaccines to have access to those countries. So I think it's practical at this point to be vaccinated.
And maybe, Dr. Pino, if the team has an extra dose, if one of these camera persons is, 35 years old or 40 years old, maybe we'll get one of them to volunteer today. Any volunteers back there? We got some. Some of them I know are older than 35 or 40 years old, but but we got some extra volunteers, so we'll see towards the end here. All right.
Amanda Dukes from WESH TV. Dr. Pino, last week you brought up the possibility that spring break may be correlated to this increase we're seeing in the younger segment of the population. You said you were investigating. Any connection, any conclusion?
Yeah, there has been an increase in the younger segment of the population. Probably by midweek this week, we will see if the numbers go real high. And part of what I was saying last week also was that we may not experience everything in Florida because we got a lot of travelers that already may be back. The question about the spring break that concerned me is that for us in Florida, a spring break is in a rolling basis because every 2 weeks someone else in another state has a spring break and everyone comes. So we have the next few weeks are going to be an increase in travel. We all heard the stories of Miami and other places that have to deal with unruly crowds, and we haven't seen that in here, or at least that we have informed. But the parks are full capacity for the reservation system in the next few weeks. So that's an indication there is an increase of activity in our area as well.
Troy Campbell with News 6. This question is for Dr. Pino. Today, the president said we're just a few weeks away, April 19th, from 90% of Americans being 5 miles from a vaccination site. How close is Orange County to reaching that goal?
Well, the 5 miles is always, there's someone, it's always a CVS at least 5 miles from anyone. And so that's one of the strategies to vaccinate, is to be able to offer in those places that are closest to everyone, especially for rural areas. They have less infrastructure. So we are doing very well. We recalculated today, just for the heck of it, 65 years and older in our county are vaccinated at 71%. And it should be higher than that because we don't have the statistics from the VA. So we could be close to 80% in 75 years and older in our county. And that's what we have seen, that significant decrease in the number of hospitalization, ER visits, although increased a little bit last week, and also the number of deaths. So that's the results. I think if we accelerate the pace, we are doing about, between the convention center and the Valencia side, we are doing about 40,000 a week, just those two sites. So if we increase distribution to the point of care, and if doctors can pre-order the vaccine for the number of patients that they want to give it to, so I think that is going to explode pretty soon. And by summer, by celebrating the 4th of July, as the president indicated, we probably will be in very, very good shape.
Doctor Pino, una pregunta en español. Por acá. Por acá. En español. Bueno, si nos explica un poco el inicio del proceso, por favor, en español, de la vacunación para mayores de 16 años. Y también esto de la reapertura al 50%, ¿no?, del límite de capacidad para hacer ejercicios al aire libre. Y si nos lo explica esa parte en español. Y al mayor, en inglés, no sé si después que usted me responda, que si se siente satisfecho con el inicio de hoy ya oficialmente de la vacunación de personas mayores de 40 años. Si hay satisfacción en cuanto a la respuesta de la gente. Gracias.
Yeah. The question in Spanish were to explain the process for minors to get registered. And what was the other? Oh, the opening of the 50% for the parks and all the public places. El 50% es lo que está en la orden ejecutiva del gobernador y por eso es que el condado se está guiando por esa especificidad. Los espacios abiertos tenemos menos preocupación que bares, restaurantes o incluso las casas de las personas donde está todo el mundo en un espacio cerrado. En el caso de los menores, lo que explicábamos en inglés es que los niños de 16, y son niños, son más grandes que yo, pero son niños y niñas. En el caso de los niños de 16 a 18 años, incluso hasta el día antes, y es un problema legal, nosotros no podemos darle una vacunación a ningún tratamiento de salud, pero en este caso vacunación, a ningún menor que no esté acompañado por un adulto que tenga la capacidad de decidir en las situaciones de salud. ¿Por qué esto es importante? Porque se han visto reacciones, no severas, no le ha pasado nada grave a nadie en nuestro condado, pero si hay una reacción tiene que haber una persona que tenga la capacidad de decidir si se hace esto, no se le hace esto a mi hijo, se transporta, no se transporta, me lo llevo a la casa, ese tipo de situación. Y también decíamos que los padres tienen que registrarse y entonces debajo de ellos les va a dar la posibilidad de registrar a sus hijos. Así nosotros sabemos quién está autorizando a quién a vacunarse.
There is a question about today, 40 years and older are eligible to receive the vaccine at all of the vaccination centers in our county. Are you satisfied with the response of those who are eligible to receive the vaccine?
We're going to have to get the numbers up, but I believe that It is still contingent upon the available inventory.
Ciertamente tenemos que aumentar los números, pero eso va a depender también de la disponibilidad de inventario de vacunas.
So we're not yet at the point where I think we have sufficient supply to be able to meet all of the various demands.
El alcalde indica que no estamos en el punto de tener suficiente inventario para cumplir con toda la demanda.
Was there another part of the question? No? That's it. Okay. We'll go to the next person.
This is Melissa Thomas of Florida National News. This question is for Mayor Demings. So last week, of course, we heard your answer with regards to kind of the lower numbers that we heard of seniors for the grassroots part in terms of reaching out to them to get the vaccines. Have you seen an increase in those numbers at this point this week?
Yes, the initiative that I talked about today, really where we have a partnership between the state and our Orange County paramedics to go directly into neighborhoods where they're underserved. And we took 2 different neighborhoods today and worked in partnership with places of worship or houses of worship to be able to provide vaccine to some 500 individuals at each one of those locations, so roughly 1,000 people. I have not received the final numbers from today, but the preliminary indication is that they were successful. They were going to likely use the majority of the doses made available.
Question for Dr. Pino, Asher Wildman, Spectrum News 13. Dr. Pino, there's a lot of reports out there saying that the vaccines are good for 4 months, anywhere to a year. I'm just curious, what information have you received, and is this potentially an alarming fact if seniors who are vaccinated in January might have to go through this process again before the year's over?
So I haven't read anything lately. I think the jury is still out for how long this immunity is going to last. And the jury is still out because we only been vaccinated since, December. But it always been said that there is the possibility that this could be an annual booster like we need for the flu. That's a possibility. And also the other issue that is still bring a lot of is those variants and how it's changing and how much it will mutate that may become resistant to some or the vaccines. So that's always been debated. That's why we want to accelerate the pace of immunization. That's why we are advising everyone to get the vaccine now, because first it's free, second is plenty, it's everywhere. So we will see what happens. But again, in a lot of things with regard to the virus, it's all new, and we will have to wait some to really have determination about those elements.
This is Steve Hudak from the Orlando Sentinel, and I am too old to be in her group. This question is for Dr. Pino and for the mayor. How concerned are you about the flow of the vaccine supply? Because we seem to have plenty of demand, but how concerned are you about what we're getting?
So I have no concerns with regard to what the convention center is getting. I have no say over everything else who is getting any. But the reality is that the state has been very responsive to us and getting us what we need. And now, because the supply is getting a lot better, instead of having a set amount, we are in a week in advance disclosing to the state how much are we planning to use for next week. And based on that and our inventory, then they decide how much to send down. We, our case, are getting 20,000 a week. The FEMA is getting 21,000 a week, just Pfizer. Then you have all the Johnson & Johnson and the different missions that are going out. Advent Health got some vaccines, as well as Orlando last week. So with that, what I'm trying to say is we are getting plenty. What is happening is now there are more players in the game and not just us.
I I guess for me, I'm still not at the point where I feel like we are getting all of the vaccine we need. That's a work in progress. You know, I am thankful that the federal government has saw fit to keep the FEMA site operational through the end of May, essentially here. And so I look forward to even seeing the output from that site increase. But we're increasing our output at the convention center. And as the retail pharmacies come online and they receive their supply, there will be other opportunities. And once again this weekend, I had the opportunity to be in a CVS, and what the manager said to me was that they had not received their supply yet. But as the CVSs continue to receive their supply, we should see other opportunities open up. Of course, someone here earlier indicated that the president said that he wanted really by May 1st all American adults to have access to vaccine, and for that to be somewhere within the 5-mile radius. Well, it is contingent upon those retail pharmacies receiving their supply. They're receiving direct allocations for the most part, and that will continue. So as the next few days or weeks come about, I am confident, as is you've heard from Dr. Pino, that our supply is increasing. So that's the good news.
This next question comes in from Grace Tui from the Orlando Sentinel for you, Dr. Pino. Her question reads, what is the county's vaccination plan for inmates at the county jail? We know a few have gotten the first dose, but is there a plan to expand that group, especially as county eligibility has expanded? What, if any, direction have county officials gotten from the state on this front?
So we are not right now in any plans to vaccinate the inmate population at the county jail. We did vaccinate all the officers, you know, the law enforcement there. And, well, they did it on, but we facilitate the process, and that went very well. So there are some challenges with the county jail, and it's how quickly most of the inmates rotate out of there into the community or into other places. So that will make it a little bit difficult to track for the second dose. So in that type of situation, the Johnson & Johnson will be a better vaccines to give. But if you are going to set a plan in that place, we probably have to have a constant supply to vaccinate everyone who is coming new into the prison that has not been vaccinated and decide to get vaccinated. So that will be part of the plan, but we have not elaborated more on that plan as we have not received any instruction to proceed with that.
The only thing I will add to that is Dr. Pino is right in that local jails are short-term stays. The people are essentially in and out. But we have vaccinated some of our senior inmates, and as we have opportunities to do that, we will likely continue to do that as well.
Thank you. This next question comes from WFTV, a producer, and this question is for both of you. The question reads, today the governor said he would ban vaccine passports in Florida. Are you concerned that could add to the amount of people who don't want to get vaccinated?
What was the governor will ban what in Florida?
Vaccine passports.
Vaccine passports.
I would assume to come into our state freely.
Okay. I hadn't heard that, so.
I haven't heard either.
This last question is from Ryan Lynch with the Orlando Business Journal from Mayor Demings. With the county slowly easing restrictions on certain amenities, when do you expect the county might encourage entertainment venues and other businesses to full capacity?
At this point, there's no mandate for those venues to not be at full capacity. However, we are still encouraged through the various CDC guidelines to socially distance. And keep in mind, we're at a point now where we still have relatively low positivity rates. I think Dr. Pino indicated the 14-day average was 5.8%, but that has been increasing. Now, he also shared with you that he expects or projects that by mid-week, we could see some significant numbers of new cases that may be related to the spring break types of activities. So I think that it is incumbent upon us to kind of hold steady where we are now. Many of these sporting venues, they have made a public policy decision about limiting the capacity within their venues, and they have done so, I think, responsibly until we really have an increased number of individuals who are vaccinated, when we have low positivity rates on a consistent basis, then you can begin to perhaps relax some of the requirements that are in place now. We still have quite a ways to go before we get up to that pinnacle of herd immunity. And Dr. Pino, with the total number of individuals who have received both doses within Orange County, what percentage of our population here in Orange County has received both doses?
For the total population, it's about 10%.
Okay. So you can see, and that's everyone, children included. When we look at the adult, the 18 plus, that number goes up slightly.
19%.
Right? Okay, 19%. So when we say that we want to see 78, 79, roughly 80% of our population vaccinated, we still have a good ways to go. So I think that there's still new cases every day. There's still people dying. Because of that, it is not the time, in my humble opinion, with advice from the experts, to really do something other than what we have been doing at this point. Okay, now if there are no other questions, we're going to ask our commissioners to come forward and roll up your sleeves. Do we have the physician here yet? Okay.
So how do you want to do
Either seat, Commissioner. You're good. Okay. And the physician, he's coming out momentarily. And
Our victims, huh? All right, smile. Let's see. Is there anything you wanted to tell me? All right, yeah. All right, so we're ready to go. You're okay.
sure they see you getting shot. Let me hold on over there.
they do it? This is the area called the deltoid right here.
Commissioner Myra Uribe is first up here. This is Dr. Thomas Prince. Piece of cake, right?
Whatever she wants.
Smile. So that was Commissioner Maribel Gomez Cordero. She was vaccinated by Dr. Thomas Prince. And next, Commissioner Emily Bonilla.
She was submitted about seconds after. So she was 16
There you go. Get to work.
That worked for him, right?
Get them done. All right, so our commissioners all successfully got through it with no problems. So this is going to conclude the press briefing. However, if I'm going to offer up any of our commissioners, if you want to do one-on-ones with them, or Dr. Pino or myself, we're here. All right, thank you all for joining us. The next press briefing is this coming Thursday at 4:30 p.m.